Connects News, now available in high definition, powered by Bright House Networks, home of free HD. From Tampa Bay's Information Center, this is 10 Connects News.
Well, still ahead, some encouraging news in the fight against breast cancer. You'll want to stick around for this one.
A local oncology practice is offering a new program that shortens treatment time. We'll chat with one of the doctors coming up.
You're watching 10 Connects News at 4.
Welcome back. October is National Breast Cancer Month, and there's some good news to report in the fight against the potentially deadly disease. Recent research shows shorter, more intense radiation treatment works just as well for early-stage breast cancer patients as longer, more drawn-out radiation treatments. And here to talk about the study is Dr. Robert Miller from WellSpring Oncology in Pinellas Park. Welcome, Dr. Miller. It's so good to have you here.
Good to be here.
And it's good to have you here to tell us about a treatment that more and more women need to know about, because sometimes women don't get mammograms because they're afraid something might be found. Well, of course, that's the whole object.
Yeah, I think the punchline is to encourage women that if they can find the cancer early,
yes,
the cure rates are very high, and the treatments now are very non-invasive, less damaging. It's unlikely the woman will require a mastectomy, and we've been able with the new techniques to reduce radiation from what used to be 6 weeks down to either 1 week, or there's a technique that does it in 3 weeks.
That's amazing. Now, I've heard, too, that sometimes radiation and chemo are paired together. This does not include chemo.
No, so traditionally, if you have to do both, the radiation took so long, we would do chemo first, and that would delay radiation. With the new technique, with the new balloon treatments that we'll talk about, the radiation is done in 5 days, and there's no delay on starting the chemo, which can start the following week.
All right, tell us how a woman might feel after her treatment.
Well, the nice thing about the new balloon technique, the surgeon makes a small incision and slides a balloon into the area where the lumpectomy was.
All right.
And the balloon is inflated, and we attach a radioactive wire to the balloon. The balloon becomes temporarily radioactive, and it just radiates a circle, a centimeter circle, which is a ½ inch right around the balloon. And when you think about it, it's a clever idea. The radiation won't hit the woman's lung, her chest, her ribs, her heart. It doesn't make her hair fall out. Yeah, very focused.
That was my next question, because we do care about that.
Yeah, and people do wonder. They say, well, with radiation, is this going to affect my heart? How do you know you're not hitting my lung? Can it scatter and hit my other breast? How do I know you're not causing cancer? So it's a clever idea. The balloon goes in, it's expanded, it sort of squishes the area right around the tumor and compresses any cancer cells into a little rim, like the peel on an orange, and then we make the balloon radioactive for a few minutes, and 1 centimeter around it gets radiated and nothing else.
And does she go home that day and then come back the next day? Or?
It takes about 20 minutes. She comes in and out. We attach the balloon, make it radioactive. She has to come in twice a day for 5 days.
Okay.
And Monday through Friday. And on Friday afternoon, we remove the balloon. She goes home, and she's done with all her radiation.
And then comes back how much later for a checkup? Months later?
Oh, yeah.
Or?
Well, normally in 2 or 3 weeks to make sure there's no signs of infection. And then we generally get a mammogram at 6 months and once a year after.
Okay, we're running out of time, but one real quick question. Is this something that you're using now, or is this just in the study phase? No,
this has now been available. We've been using the regular balloon for about 2 years.
Yes.
We're excited about the new balloon that lets us move the radiation in the balloon, and that'll be coming out next month.
All right. Thank you, Dr. Miller, for joining us. Good news for all women. We'll be right back.